Well, a very interesting story from Curtin University. America's Food and Drug Authority have agreed to a new large-scale trial for ecstasy, otherwise known as MDMA, as a treatment for patients with post-traumatic stress disorder. Now, attempts to mount a small trial in Australia to treat war veterans have been blocked. Dr. Stephen Bright is from the School of Psychology at Curtin University and joins me now. Dr. Bright, good afternoon.
Good afternoon.
Why have attempts to run a similar trial, a smaller trial, to see what the effects of ecstasy or MDMA as a treatment for post-traumatic stress disorder been blocked in Australia?
Well, I think primarily academic conservatism. I mean, we live in a small country and there's limited government funding, and almost all the government funding that's provided to investigate illegal drugs like MDMA is for research to demonstrate how dangerous they are. And I think some researchers are scared that if they support this research, it could impact on their funding, or the universities might be scared it could impact on their funding.
Also the politics of it.
Yeah, and the politics gets further. I mean, there's psychologists and psychiatrists in Australia that have a vested interest in maintaining the status of current psychotherapies. And while they do cure some people, they don't work for everyone. At the moment, if people don't respond, then the second-line treatment is usually an antidepressant, which does reduce the symptoms, but it's a bit like putting a Band-Aid on a wound that needs stitches, and the person has to take this drug for the rest of their life. Whereas with MDMA-assisted psychotherapy, the person only takes the drug 3 times in the presence of trained clinical staff, and it provides a cure for many people who have not responded to these conventional treatments.
So what would a trial look like in Australia?
So the trial that we're proposing is to investigate just a small number of people, 14 people, a randomised clinical trial, looking at military personnel. And the reason we want to focus on military personnel is because in Australia at the moment, more veterans are killing themselves by suicide than who have died in recent combats that they were involved in. There's been 41 deaths from between January and August this year. So we see this as a critical issue that needs to be addressed. Clearly, the interventions that they're being provided at the moment are not working, and being able to provide some access to what might be a life-saving medicine seems imperative.
Do you think it's because it is known as ecstasy, MDMA, it has such a terrible name? People listening this afternoon will think, well, that's just silly. That drug only has a bad reputation. Do you think that's why the politics of it is so difficult?
Yeah, there is that aspect to it, and I think it's important to distinguish between ecstasy and MDMA. So ecstasy is a pill that people may take in a recreational setting, and it may or may not contain MDMA. So most of the deaths we hear about actually are due to pills that don't contain MDMA. And you've also got to consider the difference between using a drug in a clinical setting versus recreational use. None of the participants that have completed the studies to date have experienced any serious adverse events. There's one person in an early study that got a bit anxious and they were provided with a sedative. Since then, though, the doses that they're using have been reduced. So it's likely with these phase 3 trials that MDMA is going to be a medicine in the US by 2021, and it may even be earlier given the effects that they're seeing in the trials at the moment. And it would be a real shame if Australians are unable to access this medicine because we haven't done the research, haven't undergone the training to provide the therapy, and we haven't overcome the legislative hurdles to allow people to access what could be a life-saving treatment. And this is a treatment that has the potential to be paradigm-changing for psychiatry.
Okay, and there would be caveats and guarantees that should people have an adverse reaction or suffer from anxiety, that would all be taken into consideration and smaller dosages
Absolutely.
administered?
It's all, we have a thorough protocol based on what's occurred in the US, in Canada, in Israel and other countries, and it just seems ridiculously conservative that we have been unable to replicate this research in Australia.
Interesting, and good to speak to you from Curtin University this afternoon, Dr. Stephen Bright. Thank you for your time on 720 ABC Perth.
Thank you.